In this video, we are going to look at hypovolemic shock. What is hypovolemic shock? Hypovolemic shock happens when there is heavy loss of blood or fluids in the body. It is low volume of blood in the blood vessels. There are many reasons why one could have hypovolemic shock, and we're going to look at them now. The first reason is as a result of external bleeding. What are the things that can cause external bleeding? There are things like traumatic injury or major surgery. They can lead to acute hemorrhage, which then leads to hypovolemic shock. The second reason is internal bleeding. On internal bleeding, the causes could be an aneurysm that has burst, pancreatitis, ectopic pregnancy, or gastrointestinal bleeding. Gastrointestinal bleeding could be upper bleeding or lower bleeding. Then we're going to look at the third category, which is fluid loss. What are the things that can cause fluid loss? Things like vomiting, things like excessive diarrhea, things like major burns, like electric burns, things like excessive use of diuretics, or even dehydration. They can cause hypovolemic shock. Now, what are the signs you need to look at on a patient? Patient might have pale skin due to blood loss. There will be increased heart rate, tachycardia. Patient will have cold and clammy skin. The blood pressure will drop, hypotension. And there will be rapid breathing, tachypnea, and patient will have generalized weakness. Let's look at some lab tests you need to do, or blood tests. We can do things like ABG, arterial blood gas, for oxygen saturation level, CBC, complete blood count, to check how much blood lost, and lactate, and CT scan, maybe to visualize other parts of the body, other organs of the body, if there's any harm caused by hypovolemic shock. And then lastly, we look at the treatment. What are the treatments that you need to give to the patient? First is to stop the bleeding and stop the fluid loss. Second is to replace volume. How can you replace the volume? Giving intravenous fluid, through blood transfusion. You can give other blood products such as plasma or albumin, and then medication to support the blood pressure, which has dropped. And we looked at hypovolemic shock, what it is, what causes it, signs you need to look out, the labs you need to do, and the treatment you need to give to patient. Thank you for listening to my video. Please like my video and subscribe and share with friends.